So, in addition to these physical signs, how else can we determine the various types of liver disease? A really easy and simple way is through liver function tests. And these are a set of blood tests that can help you identify what is actually happening with the liver or what the underlying etiology is. The first set of tests is the AST-ALT, which is aspartate aminotransferase and alanine aminotransferase, which are two enzymes that indicate liver cell injury. These are enzymes that can be generally found throughout the body, although ALT is a little more specific to the liver, but are typically highly elevated when there's damage to the liver. For example, if you have cirrhosis, acute liver failure, or anything that causes liver cells to die. When you see both elevated AST and ALT, with ALT being greater than AST, it's often a sign of viral hepatitis, as well as non-alcoholic hepatitis. Whereas if you have your AST being greater than your ALT, that can often be a sign of alcoholic hepatitis. The second test is the alkaline phosphatase. Alkaline phosphatase is actually one of the products of liver synthesis and is a sign of how much or what the liver is doing. If there's an elevated AP, there's increased synthesis, which means that your liver is working harder than it should. This can be once again of cholestasis, in which there can be blockage of the bile ducts. If there's blockage of bile ducts, your body still wants to excrete this bile and doesn't know what's happening. Why is there no bile acids getting into my duodenum? And it will cause more excretion, and that causes the liver to work harder and an increase in AP. A couple of other more specific tests, which I'll talk about as I talk about specific liver diseases, include iron, ANA, or anti-amino antibody or anti-nuclear antibody, the viral hepatitis antibodies, and bilirubin can also be checked for specific in case of suspicion for specific liver diseases. So, in looking at the tests, there are two broad main categories of liver disease. First, you can have hepatocellular liver disease. So I'll call that HC, which is typically represented by an increase in AST-ALT. Once again, this is a sign of liver cell damage. And there can also be cholestasis, in which I'll spell out cholestasis, in which this is typically referred to by an increase in AP, and once again is more of a problem with the bile ducts or the vessels that allow excretion of the products of the liver. So first, let's talk about cholestasis. There can be two main areas where there can be blockage of the bile ducts. It can be intrahepatic, in which the smaller bile ducts inside the liver are blocked up and no longer allow flow. This can be an example can be primary biliary cirrhosis. Or it can also be extrahepatic. After it leaves the liver, there can be strictures or consolidation or just blockage of the actual bile ducts going to the gallbladder or actually into the duodenum. And this can be primary sclerosing cholangitis. And cholangitis is actually the inflammation of the gallbladder. Another cause can be what's called cholelithiasis or choledocholithiasis, which are essentially gallstones. The difference in terminology is whether the gallstone is in the actually in the gallbladder or in the gallbladder's duct. The DOCO stands for duct. So both primary biliary cirrhosis and primary sclerosing col, um, cholangitis are types of autoimmune disease, although the etiology isn't quite sure. So let's move on and talk about hepatic cellular disease. Hepatic cellular disease, primarily, there are three main types that cover, I would say, maybe 90% of hepatic disease in the US. The first is viral hepatitis. Viral hepatitis is creatively named A, B, C, D, and E in order of their discovery, but doesn't actually say too much. B, C, and D can be chronic, while as A, B, and DE can be acute. A lot more can be said about viral hepatitis, but for the sake of simplicity, I'll just mention that these are viral diseases in which viral infections in which the body's response can cause fatty liver, inflammation, fibrosis, and eventually cirrhosis. The second main category of liver disease inside the liver is alcoholic liver disease. The name of this disease is fairly self-explanatory. This often occurs with people who have a chronic history of large alcohol intake, and has a pathway in which first it causes the liver to become fatty, then the liver to become fibrosed, and eventually to become sclerosed, or cirrhosis. So once again, this is the result of too much alcohol consumption, which has been shown to increase the amount of fat that's being retained in the liver, and also increase the amount of oxidants in the liver, which causes more oxidative damage and eventually causes the harms that's an alcoholic liver disease. The good thing about this disease is that it's often reversible if you don't go too far, as long as you stop drinking alcohol. And the final main type of liver disease I'll talk about is NAFLD. Sorry, the F is a little weird, which is NAFLD, which is actually non-alcoholic fatty liver disease. This is actually a fairly new disease and it has been fairly new to be characterized, but in terms of distribution and incidence has increased dramatically in recent years. This is in which pattern of fatty liver and increased inflammation and eventually cirrhosis occurs with people who don't actually have a history of alcohol abuse. And this is actually very strongly correlated with both obesity and diabetes, and is often described as a symptom of hepatic destruction in response to metabolic disorders or metabolic syndrome. Essentially, this is because the liver is becoming insulin insensitive, which is causing a lot of the accumulation of fat in the liver and eventual oxidation and cirrhosis that you see symptomatic of alcoholic liver disease, but without actually any alcohol. The last thing I'd like to talk about is also a hepatocellular liver disease, but is often iatrogenic, which means is caused by humans, or in particular caused by physicians. And this is called drug-induced liver disease. And this is actually one of the major reasons why the FDA takes drugs off market, or throughout the span of phase 1, 2, 3 trials, it's actually the number one indication of why a drug is not approved. Essentially, the liver does so much, and a lot of side effects can happen in which drugs affect the liver in ways that people don't expect. The liver can cause an increase in solubility, which actually increases drug concentrations to hazardous levels, or it can oxidize different drugs to cause oxidative damage and also cause liver disease. One major point I like to talk about is the risk of acetaminophen or Tylenol in causing liver damage or liver disease. Acetaminophen is a very commonly used drug. It's Tylenol, it's over the counter. But when you overdose with acetaminophen, it can cause grave liver damage. And this can also be exacerbated by co-current liver disease, such as an additional viral hepatitis, or it can be caused by co-current activation of increased cytochrome P450 enzymes, which can be caused by an increase in alcohol intake or an increase in phenobarbital or anesthetics. Essentially what happens is that acetaminophen is converted into an active product that causes its effect with pain relief and other beneficial effects. But there are toxic intermediaries that can occur and that can be accumulated if there's an overdose in Tylenol. This is actually one of the major causes of acute liver failure, and it's a really difficult disease to treat because even after you have an OD on Tylenol, for the first 24 hours, you don't have very obvious symptoms. You'll feel some nausea, some vomiting, but you don't think it's a big deal. But after 72 hours, you'll have hepatic encephalopathy, you have hepatomegaly, in which your liver is enlarged, and you will have acute liver failure. Unfortunately, I have an antidote for acetaminophen overdose. This can only be used in the first hour or very acutely, very quickly after the toxicity. It just doesn't work as well when you come into the ER 1, 2, or 3 days afterwards. So once again, this is a brief overview on what the liver does. The liver is an amazing organ that takes care of the body so well. It's responsible for a lot of synthesis of important macromolecules. It's responsible for detoxification, excretion, and when the liver does not work the way it's supposed to, there's a variety of systemic signs, both signs that indicate a particular disease, as well as non-specific signs, such as jaundice, right upper quadrant pain, and weight loss, anorexia, nausea, vomiting. And there's a variety of diseases that affect the liver. This can be both in the bile duct, which causes cholestasis, as well as hepatocellular disease.